Pamela, thank you so much for taking time to talk with us today. As I said in the email, this is part of a two-part series that we're doing on the maternal mortality crisis in America. So our first episode actually is going live in about half an hour, which is just taking a broad look at what the crisis is, particularly for Black and Brown women. But I feel that oftentimes when this conversation happens, or any talk about healthcare, oftentimes we forget about those who are incarcerated. And so I just wanted to take a moment to acknowledge that, and to start off just not even discussing pregnancy just yet, but the conditions of what healthcare is even like for those who are incarcerated and why we don't talk about it enough.
Okay. So as far as what conditions are, and before I even get into that, thank you all for having me, and definitely thank you for bringing awareness to these women. You are right. They are often left out of the conversation, which is part of my job to make sure people remember to include them. And basically that's what I do. Just recently I was with the Department of Public Health, and they were talking about their research on maternal health here in Georgia. And they gave all this beautiful data, but none of it included incarcerated women. And so at the end of the presentation, I had to remind them that the data was incomplete. And everyone had this blank face, looking back at me like, what do you mean? We did all this extensive research, da 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 da. And I said, yeah, you did, but you forgot a population of women. And if those women are not included, then your data is not complete, because they also are women here in Georgia. They also are pregnant, and they also are part of this conversation. So they are often forgot about, as you said. As far as what healthcare looks like for incarcerated women, there is basically none. To be frank with you, definitely in my situation, I didn't receive anything. And so when I say there's none, what I'm saying is that there's not a standardization of care for pregnant women in facilities, whether they are local, county, federal, there's no standardization of care. Each entity, each facility does their own thing when it comes to how they decide to care for not just pregnant women that are incarcerated, but women, period, that are incarcerated. So that's one of the big issues that we have, that makes this work so essential, so urgent, and so vast, because everyone has their own way of dealing with it. None of the penal institutions are required to have joint commission or certifications or anything like that. So they choose that at their own, discretion. Same with the private facilities, and they are definitely conducting things their own way because they are private. So most places don't have contracts with OBGYNs. They usually don't feel like there's a need to, unless an emergency occurs. And then when that emergency occurs, they are scurrying around trying to figure out how to handle that, which is usually just taking a woman to whatever the closest hospital or whatever is to be seen. State facilities and federal facilities do tend to do a little bit better, where they do have some communication with healthcare professionals that specialize in women's need, but again, nothing on site. So unless a woman is experiencing something of extreme, urgency or emergency, there's nobody on site to see them. And a lot of times when these cases come up in an emergency way, depending on where the facility is located, because most of them are located in rural areas, will they get to a place in time, before the woman is in a dire situation, life or death thing, before they can be seen?
It's so heartbreaking to hear in so many ways that these women don't have access to what should be just, I mean, common sense care in a lot of ways, especially being pregnant. And as we know, when we talk about the maternal health crisis, it disproportionately affects Black women and brown women and their babies as well. But so does incarceration
Correct.
disproportionately affect Black women and brown women. Um, so when we look at that, can you just talk about how this then becomes not just a social justice issue, but a racial justice issue?
A racial justice issue, a public health issue, a human rights issue, is essentially what it is. And I often tell people when they say criminal justice or social justice, I'm like, no, my work is human rights work, because the things that we ask for these women should be given to any human being. But what we have to remember is, first of all, that these facilities and this whole penal system was based on men. And so because of that, that's why we have all these deficits when it comes to women. Something as simple as menstrual supplies. Men don't experience menses. So therefore, that was not put into the program when they created these facilities and the protocols and policies under which they operate. So that's the biggest caveat of this whole situation. And then of course, race plays a part, because again, not only was the penal system created for men, it was created based on slavery and Black and brown people, to capture them, to keep them under control for whatever reasons that were needed during that time. With the Emancipation Proclamation and slaves being freed, now sharecroppers didn't have people to work those farms, to do that labor for them. So there were a different number of needs that became an issue and an urgency for, slaveholders and Southern plantations, and, keeping their economy going, and even their households for that means. And so they created the penal system then to capture these folks that didn't have any kind of designated stability once they were freed. They were locking them up for quote unquote loitering, because they, didn't have a job, they didn't have any designated place to be. And our system has just grown from that. So it was created for Black and brown people, and it continues to be so. And so that's why we see more of us incarcerated than others.
You touched on something that I don't think many of us think about, which is the fact that this system was designed for men. Um,
Yes.
and I think that just kind of blew me away for a moment, because I mean, obviously that's like so many different things in our society, but as you pointed out, when it's designed for men, there's so many other elements that are lacking. When you think about periods, when you think about pregnancy, when you think about even just everything that goes along with all of those different items. And so
Even clothing.
clothing,
It's
yes.
impossible, literally impossible, to find a bra, and a bra that actually fits you correctly, because the uniforms and the clothing that the women wear are men's clothing. A lot of the clothing is big and kind of hangs off of them because it's men's clothing. And women their frames are built smaller than men. So it's simple as that.
Wow. These things, it again just sort of blows my mind, and I think draws attention to how uninformed much of our society is on what this reality is like. But I think, you know, so it seems like, particularly with the maternal mortality crisis, that there has been more attention seemingly within the last few years. And I'm curious if that's a sentiment that you're getting as well, especially with Restore Her.
It's a sentiment that we're creating. So I say that to say, if we were not out there doing the work and kicking the doors in and, shouting to the top of our lungs, at the top of the mountain about this, then it would still not be as prevalent as it is now. So because of my own lived experience of serving a 78-month federal sentence where I was pregnant, And I was at a facility where I was told that they didn't expect to have women. They definitely didn't expect to have a pregnant. There was absolutely, quote unquote, nothing that they could do for me. And when I questioned what nothing was, they said we can't even offer you a prenatal vitamin. And then being shackled, and the shackling caused me to fall and miscarry my baby, and listening to the medical staff and the officers debate about what to do with me because they didn't have a plan. As I'm hemorrhaging and experiencing my miscarriage, the medical staff was saying we should call 911. She's losing a lot of blood. Whereas the correctional officers were like, no, we should call the marshals. And I'm there in the middle begging and pleading, for the life of my baby as well as my own now because I'm hemorrhaging, to just please call 911, which they finally did. And then the marshals met me at the door and immediately cuffed me by an ankle and a wrist to the bed, which is how I endured the remainder of my miscarriage with two male officers between my legs that refused to give me any privacy. They didn't even understand the need to offer me privacy. Even when being asked if they couldn't leave out the room, if they could stand at the head of my bed, they still refused and remained between my legs the entire time. And to add insult to injury, when asked where was the linen that I had come with, that I had bled on, because once they were able to stabilize me and do an ultrasound to check the status of my baby, it was determined that I had passed the fetus, and they needed to see it to make sure all of the parts were there. And the officers were like, oh, we threw that in the trash. So not only am I sitting there dehumanized because I have these men between my legs, now to hear that they threw my baby in the trash, and the tone, the nonchalantness of it was as if they felt like it was actually trash. And then to put me in solitary confinement immediately after this occurred. So, and my story is just one of thousands, and it's not even the worst, which you all probably know because you've seen things in the news where women have had babies along in cells and, other horrific experiences that have happened by these women. So that is what brought me into this work, because coming home, I was told there was nothing that I could do. And I just refused to accept that. And I've made it my mission to change that. And we've been blessed that the bill that I drafted, and partnering with, at that time, Cut 50, Jessica Jackson and Van Jones, we were able to, the first year that we worked together, passed a bill that returned dignity for incarcerated women, in a total of 8 states initially, then 15, and then I've continued to work on my own, because their priorities kind of shifted. And to be able to have advocated the passing of the dignity bill in 22 states now, I would say, has what brought this to the attention of people and making them finally understand what's happening with women that are incarcerated.
Hearing your story, and I know it was something you testified before Congress as well
Yes.
about your experience. And I don't think at any moment reading the testimony, hearing your story now, that there's not a moment where there's just this visceral, I've never been pregnant, I've never had a child, but listening and feeling like, where is the humanity for you? Where is there something wrong with our prison staff to look at this and to see a woman who is hemorrhaging, who's pregnant, and to say, to treat you that way? And as you mentioned, this is happening to women all over our country. And I think something that consistently, whenever I hear about shackling, that's so jarring for me, is just the images of slavery that it consistently
Yes.
brings up for
Yeah.
me. That I wonder sometimes if other folks, maybe who aren't Black, don't make that connection to then, as you said,
I don't think they do.
it goes back to slavery, our carceral system. And
Even
so
the second part, when women that are fortunate enough that they don't lose their babies and they give birth, here in Georgia, these women have 24 hours to say who will take care of their babies. And if nobody shows up, they automatically are given to the state. These women end up losing their rights and their kids, which is another part of that slavery piece that is still in existence through the penal system.
This is also, I heartbreaking isn't even the word for these injustices that we're seeing. And the work that Restore Her has been doing to get these legislations, these bills passed, and especially I know shackling for so many is ending shackling is such a huge component of that. And I don't want to belabor the point, but I know with your situation, it caused you to fall. What else are some of the issues with being shackled while present, besides just the moral image of a person being shackled? What are the issues with shackling a pregnant person?
So the issues are, women are already being pregnant imbalances your equilibrium. So they're already off balance because of a pregnant baby. Shackling adds to that. So they're more prone to falling. And then, like in my case, I was black boxed, which means that my wrist cuffs were attached to a double chain around my belly and held my arms in place like this. So even when falling, I was not even able to brace myself or try to catch myself because I was stuck in a fixed position, as well as my ankles were also cuffed and connected with a chain between my legs. So all of that hardware, and you're in a fixed position. So the fall is like imagining a tree falling. It's a very hard, very flat fall, a free fall, as you will, with no way to brace or protect yourself. Not only that, the double trains around your belly, can cause constriction. It can precipitate contractions because of the weight of these chains. There are a number of things, just even with circulation, with the cuffs, because they're designed to get tighter as a person moves. So just restricting proper circulation, which is really adequate when you have another body inside of you that's relying on your proper circulation. So yeah, there are a number of things, not to mention all of the mental things that go along with it, psychologically, being shackled and what that means in your psyche to know that you're sitting there bound up in chains as if you have, are a mass murderer or have done something horrific. And based on that, let me quote that 90% of the women incarcerated are incarcerated for non-violent crimes. Over 80% of them have kids under the age of 18. And over 80% of them have experienced some type of traumatic situation. So this does not help any of that. It exacerbates the harm that has already been perpetuated towards these women.
Your work has seen, is it 22 states passing legislation? I don't think
And the
there's,
federal level.
and
We were also blessed to be able to draft the language for women in the First Step Act.
so we are seeing steps, but there's still was like half the country still doesn't have necessarily that same piece of legislation, but maybe are trying to take more steps. What can the public do to get more protection for incarcerated pregnant people?
So, like you say, we have passed legislation in 22 states. And to get you current, there are approximately a total of 40 states that have something in place. May not necessarily be a law. We know in 22 states, we have passed legislation. In the other states, they may have statutes or policies or something like that in place. However, with all of that being said and all of the work that we've done, there is still a problem. Women are still being shackled. Women are still being placed in solitary. And it's because, one, we don't have data to know, we don't know the real number, true number of women that are incarcerated in the United States because the data is not provided to us. So that's one piece. And because of that piece, implementation of even the things that we put into law, there's no overview. We don't know, you know, a way to keep up with making sure that these laws that we pass are being implemented without that data. So implementation is a big, big, big problem right now in all 22 states with everything that we've done, even with the other remaining that make the 40 that have something in place. And because of that, we drafted a succession legislation called the Women's Care Act. And what the Women's Care Act does is defer the women's sentencing or her serving that time until a minimum of 12 weeks postpartum after she has her baby. That's the base bill. We were fortunate. I have a colleague and a friend, Pamela Clifton in Colorado, that reached out to me to find out what we were working on. I told her about the Women's Care Act and I sent her the base bill. And she got it introduced there in Colorado. And because Colorado is a progressive state, they added that the woman get deferment up until 12 months after delivery of her baby. They also put in other alternatives like women getting furloughs and other types of things. This bill passed in 23 in Colorado. So we did have the first women's care version of a Women's Care Act passed in Colorado. And we're definitely excited about that. Because for me, what we need to do is take pregnant women out of the prisons. And because it's deferment, we're not saying that these women will not be accountable for whatever mistake they made. But what we're saying is allow them the time to have a safe, healthy pregnancy, deliver their baby in a safe, healthy environment of their choosing, and then give them ample time to bond with their baby, to be able to breastfeed, and to have time to make proper arrangements for when it's time for them to go serve their time, that they don't have the anxiety and the stress and the psychological trauma of wondering where their baby is, if their baby is being cared for, and how will they get their baby back? Because that's what women are up against now. So not only are the laws not being respected and carried out, when these women lose their babies to the state, now they have to serve that time wondering where their brand new baby is, if it's being taken care of well. And then they have to get out and find that baby and then fight to get the baby back because they've lost their parental rights. That's not what they're sentenced to. They're sentenced to serve that time, and that's it. So, and think about all of the psychological trauma that comes with all of that. So these women are coming home in a much worse state than when they left. They're not sentenced to that either. And so what we're asking folks to do is in their states, request through their legislators the Women's Care Act, alternative sentencing. So it's childbirth alternatives, resources, and education, because we're also providing resources and education for these women by allowing the state or to partner with nonprofit organizations such as mine. And there are a number of organizations out there that provide services, direct services, programming, all types of things, childbirth classes to these women. But because of lack of transparency, we're shut out from being able to do that. And we have our own resources. So it wouldn't cost the state or the county or any of these facilities any money to allow us to do the things that we are missioned to do.
Something that stood out to me when you were talking is about the 12-month period, having that full year to be able to not only have a safe pregnancy and deliver safely, but to have that time with your newborn, and how important that is. Like, I don't think any mother who's not incarcerated would ever take that for granted. And when you look at it that way, and that's kind of what it is, then when you mention these women who their babies are taken from them, and possibly never given back if they can't find them. But something else that stood out to me was about how, when we look at the maternal mortality crisis for Black women, that the possibility for death is that full year after pregnancy, in part because of the lack for resources. And as we were just discussing, if you're incarcerated, then where do you get those resources from?
Right.
And so I see how important that is, and it's amazing that that's something that has happened. So we know it's possible that this could happen, that these steps are possible. But we also know, as you mentioned, at the federal level, we have seen the Black Maternal Health Caucus, so Lauren Underwood, Alma Adams, Robin Kelly as well, and even Vice President Kamala Harris. This was something that was important to her since she was a senator. Does the incentive have to come from our federal government to change the way pregnant, incarcerated people in general are treated, or do we have to focus on having that change happen at our state and local level?
I would say yes, it does help as an incentive to have the feds and federal legislators and federal legislation involved to give incentive to the state, because many times a lot of these states rely on this money, unfortunately, that they make off of having folks incarcerated to run their economy. So to know, and then a lot of times we come up with that when we're working on legislation, when they're asking about a fiscal note. What is it going to cost me to do this? But in essence, the Women's Care Act actually does not cost money to them. It really saves them money, because if these women are not in the facilities, that saves them money for having to find a care provider that they would have to pay. And when we looked at the cost for a prenatal visit of a woman incarcerated versus one that is not is 3 times more for the incarcerated women. And so they would be able to provide their own prenatal care and not have to rely on the state to have to pay for that, and taxpayers to have to pay for that, including the births. The cost of the births are a lot higher, 2 to 3 times higher than if they were going in on their own as, a citizen to give birth. So it actually costs the state money. But yes, I think any federal incentives would help also to make the states be more motivated to, do something of this stature.
And Pamela, I do want to be conscious of your time because we so appreciate you talking with us. So just one more question, maybe a little bit of an
Sure.
emotional question. As this fight for dignity and human rights for incarcerated pregnant people continues, what words would you want to say to women right now who are either were in a situation where they're pregnant and incarcerated right now, are worried about their babies right now as they're incarcerated, or potentially even facing the same struggles and difficulties that you faced where they lost their baby or they're worried about losing their baby right now?
I would tell them, don't be afraid to use your voice. It's the best advocate that you have, speaking up and saying what you need, and what's important to you. Because in a lot of these situations, these women that lose their lives and the babies that lose their lives is because we don't speak up. Don't feel like because you are incarcerated or you are under I guess a legal process where you may be still going back to court and have not been convicted or sentenced yet, that you don't have the right to say anything. I know many women think that because they are incarcerated, they don't have rights. You still have rights. And so it's very important, though, if you're not voicing what your needs are, what your complications are, what your problems are, what's urgent for you, then that's always the excuse of why you didn't receive it. So if nothing else, make sure you voice it, make sure you document it. Documenting is very important because then you can show where you voiced it, who you voiced it to, and what was the outcome. And that's very critical and very helpful when we're fighting to get all of these things changed and to get folks treated like human beings. But you are your best advocate. Don't be afraid to speak up.
Pamela, thank you so, so much for taking time to talk with us today. There's so much information, and I'm so happy that we'll be able to share a lot of the information that you told us with our listeners, especially as you mentioned that the in Colorado, just knowing that it's possible, I feel like hopefully it gives a little bit of hope
It
to.
gave me hope. When I tell you that that moment, I can't even put into words how I felt in that moment. Even when Pamela sent me the article showing me that it was passing through the House and they were in favor of it, was like, I don't know, my heart just was like bursting with joy to see that someone cares, about these women, and someone gets it and understands that the best place for them is not in a facility, not, in a correctional facility. And so, yeah, it gives me hope that, other states will get it as well and catch on. Matter of fact, we are introducing the legislation this year in California because they reached out to us wanting to implement the bill there, and they're basically going to implement something very close to Colorado because they're more progressive as well. I'm working with an organization here in Georgia that's been here for over 50 years, Healthy Mother, Healthy Babies. It's going to be their primary legislation in session this year, and in Alabama. So Alabama was the 22nd state to pass the shackling legislation, and now we're coming back to them with the Women's Care Act. So I'm excited that, other states have recognized it and understand the need. And I'm looking forward to celebrating those wins this year, and definitely taking it to the federal level because it should be federal legislation.
Absolutely. And I will be following along very closely as well. So hopefully we will be able to speak again in the future because
Yes.
this is such an important topic for me. And as I mentioned, I just feel like, first of all, the topic itself doesn't receive as much attention as it should. And then when we start to break it down and include incarcerated women who should be included in this, it's even less aware. So I will definitely be following along and hopefully be able to speak again.